Yasser Bטלבי, good morning. Hi.
Hi, thank you. Nice to be with you.
So, Yasser, how are you? How do you feel?
I'm doing great. Feeling awesome.
When did you get the first and second doses of the Moderna vaccine?
So I got the first dose of the vaccine in mid-October, and then I received the second dose on November 12th, so some number of weeks ago.
What has motivated you in the first place to participate in the trial?
Well, I mean, just what's been happening with coronavirus. Coronavirus has just decimated people's lives and livelihoods too. There are, people who are frankly dying alone in hospital rooms, and people who've lost their businesses, who can't make rent, car payments. I mean, it's a human tragedy, and needless to mention all the other things that it's impacted. So I felt personally compelled to try and do what I could because, I'm not a frontline medical worker or an emergency worker. So I felt like I was helpless, that there really wasn't anything I could do except perhaps enroll in one of these clinical trials, since it was my belief, and I think it's now the understanding that's common, that mass scale vaccination is really the only legitimate way that we have to get out of this pandemic that we're in.
So Yasser, we all have to know, have you suffered from any side effects?
Well, yeah, so I had mild flu shot-like side effects when I got the first dose. I was, pain at the site of injection, a little bit of numbness, stiffness. I couldn't really move my arm above my shoulder, but it was bearable for sure. Afterwards, the second dose, that was a little bit more significant. I suffered a little bit more serious symptoms. I had a low-grade fever, chills, headache, stuff associated with that. But I actually called the study doctors and I asked them, hey, I'm feeling not the greatest. And they told me that I shouldn't be alarmed because it's in fact one of the possible side effects that you can experience. And they just said I can have some painkillers. And
I've heard someone describe it as a hangover. Can you relate to that?
Yeah, I would say it's definitely similar to it. But for me, it was a little bit worse. I don't really get bad hangovers, but it definitely felt like you were sick. And so I guess the best way for me to describe it is feeling almost like you have the flu, but it's different in the sense that the symptoms disappear very quickly, especially with painkillers. So after I took some painkillers, I was ready to go the next morning.
How concerned and troubled were you the moment you started to feel the side effects, the fever?
Oh, well, I was worried. I frankly thought that I might just be getting sick, but with something else. But I obviously got, a COVID test and all that as part of the study, and that was obviously negative. But I wasn't sick. It was is most likely just symptoms associated with the side effect. At the end of the day, I, also called the doctors. I spoke with them, and they gave me a lot of confidence. I understand how messenger RNA vaccines work, and they're not gonna, really do anything to your body that's of serious concern, other than obviously building antibodies to COVID-19.
So the Moderna people, the medic team, kept in touch with you?
Well, in fact, I've actually never been in touch with anyone from Moderna. So Moderna is trialing this vaccine here in the United States in about 80 to 100 different test site locations. I live in Boston, so I participated out of Brigham and Women's Hospital here in Boston. And so the study doctors are unaffiliated with Moderna. They are part of this double-blind randomized control trial study, which essentially means neither the study doctors nor I know whether I've received the real vaccine or a placebo. That's how they judge the efficacy of the vaccine, which means the way they do it is by trying to see how many COVID infections develop in the vaccinated group versus the unvaccinated placebo group. And we know now, based on the numbers that Moderna has released, that there were very, very few COVID infections, I think maybe 11 amongst 15,000 in the vaccinated group, versus the unvaccinated group had hundreds of COVID infections. So once you do the math, you can find out that the vaccine is about 94% effective.
Yasser, will you personally recommend the Israeli people, for example, to get vaccinated?
Well, whenever the vaccine is approved by whatever regulatory body that Israel would use to approve vaccines generally, yes, I would recommend it. But we have to wait for that official approval. These folks who are career scientists will have to look over this data to make sure that at the end of the day, they're looking at it objectively and they're making the right decision. I recommend Israelis to do what public health guidance suggests. And I know for the most part, Israelis are doing that. They're staying home, they're washing their hands, staying socially distant. And, obviously there are some folks who are not doing that in Israel, but I think that's always a concern everywhere. And it's tough for governments to manage things like that. But I think overall, it's tough for governments anywhere, especially in Israel, to manage situations like this. But it's been good. I mean, people should just follow public health guidance. And when it suggests a vaccine, take the vaccine for sure.
Okay, Yasser Bטלבי, thank you so much for this interview.
Thank you.